Hi, everybody. This is Karen LaFrazia from St. Francis House, and I want to thank you for joining the call today and welcome you to an update on how things are going at St. Francis House. We've been, hearing from a lot of people, a lot of emails, a lot of phone calls, and before I even tell you anything about St. Francis House, I think the first thing I wanted to say is I hope all of you are doing okay. This is a crisis that has affected every single one of us. And I so appreciate the fact that you've taken some time out of your day to check in on us. It's that kind of tremendous support that we've been receiving from so many people. It's really what's carrying myself and others through the day. Um, I guess the first thing I might want to share is that many of you know that, as I say, this is a crisis that has affected every single one of us, and it's certainly affected me personally. Many of you know that I've actually tested positive for COVID, and my symptoms. I just wanted to reassure everybody I'm perfectly fine. It was very mild symptoms, but that is the reason why I'm doing the call from home and not from the shelter. Um, so can't wait to get back on the ground at 39 Boylston. And can't wait to actually, live in a time when I can actually talk to each and every one of you face to face and in person. It's hard to believe that just over a month ago, I was having lots of conversations with many of you about our plans at St. Francis House for the future. Right before COVID hit, we were had just had a tremendous undertaking where we were working with our architectural team from Mass Design about how we were going to be transforming the shelter into a truly trauma-informed engagement center. And I got to tell you, if this crisis has really put a spotlight on just the inadequacies of our building in caring for sick and vulnerable people. So once this is over, we'll pick that work up and pick it up with new information, actually. We were also had just launched the Urban Hound at St. Francis House and started our first class of the Dog Care Academy. We had just opened our recovery support center, and we're getting ready for a ribbon cutting ceremony with the mayor. And so what feels like a long time ago now, even though it was only a few weeks ago, everything just stopped and we had to pivot on a dime and find new ways to support our guests. And so, as I was saying, the reason for this call is because I'd received so many phone calls, so many emails, really falling into three broad categories: people wanting to know what we were doing, people wanting to know how we were doing, and people wanting to know how they can support us. And so, I'm hoping today, in the next few minutes, to be able to answer those questions. If you've sent a question and it doesn't get answered today, please feel free to email me or call me. Be more than happy to go into more detail with everything that's going on at St. Francis House. But as I was saying, sort of like on a dime, overnight, we essentially had to create a new business model. And for staff, we felt that it was really important that we were and continue to be a responsible employer. So the first thing I want everybody to know is nobody was laid off. For staff that could do their work from home or work remotely, we've sent them home. And we've had to be creative in other ways for those staff so that they can continue to contribute and continue to support our guests. So in our housing program, I think many of you know, we have about 102 units of housing in 2 different locations. About half of those are on site at the top 4 floors of our building at 39 Boylston, and the other half are across the street in our new building at the Union. And case managers now, instead of meeting in person, face to face with those residents, they're providing support over the phone and remotely. And I suppose that was the first challenge that we faced in supporting those folks, is most people didn't have a telephone, they didn't have a cell phone. And so we had to go out into a whole bunch of different stores and we bought a bunch of burner phones. So many so that the fraud department at the bank called me because they weren't sure why my credit card was being used for so many cell phones, and we cleared that up. So now we have a way to communicate with all of those residents, and we're checking in people. We're checking in with people by phone. We're making sure that they have enough food. We're arranging for food deliveries. We're making sure people have the toiletries. We're helping make sure people can get their prescriptions filled, connect them with their medical providers, and doing a lot of emotional support for the folks in our housing. In our workforce department, we're also checking on people remotely. We're checking in on about 130 folks that had recently graduated from one of our workforce programs. And so many of them have lost their jobs. We're helping them to navigate filing for unemployment and filing for SNAP benefits. We're doing everything we can to make sure that they don't fall back into homelessness after all the tremendous gains that they've made in their lives. For the students that are in our Moving Ahead program, we're continuing to pay for their sober housing and provide them their weekly stipends until classes can resume. And just this week, at the request of the City of Boston, we have begun taking applications for a new fund that will help move people from shelter into some other type of housing arrangement. A lot of it's renting rooms for people in sober houses or rooming houses, where people have their own room and maybe are sharing a kitchen or a bathroom with a few other people. And it's absolutely much safer and has a lot more dignity than living in a congregate shelter right now. Um, and I guess I would say it's here at the shelter level that we're seeing the most challenge. Um, at this exact moment, when all of us are being told to stay at home and to distance ourselves from other people, it's the men and women who are homeless. They have no home to go to. And we all know that the safety of a home is our first line of defense against getting the virus, and it's the place where we will recover and recuperate should we get sick. And this is the very thing that defines the men and women that we're serving, by the lack of by what they don't have. And so for hundreds and hundreds of men and women, so many of them already have a compromised health condition, which already makes them vulnerable for contracting the virus. Uh, they're forced into overcrowded shelters where achieving social distancing and having the ability to wash your hands throughout the day, take care of other kind of sanitation needs, it's just really, really challenging. And so every morning since this epidemic began, I'm on a call with the City of Boston, with the Boston Public Health Commission, Boston Healthcare for the Homeless, Pine Street Inn, the Boston Medical Center. And I have to say, it's been nothing short of miraculous what has been created in the past few weeks. Uh, I'm not sure, but I think many of you probably know by now that the Boston Convention Center has been transformed into a 1,000-bed medical facility. And this is for people who are sick, but not so sick that they need to be in the hospital. And of those 1,000 beds, 500 of them are dedicated to caring for people who are experiencing homelessness. And that is being staffed by Boston Healthcare for the Homeless. In addition to that, the East Newton Pavilion, which was been closed for the past 18 months, that has been reopened by the Boston Medical Center. And that's to provide recuperative care for people who are homeless as they recover from being sick with COVID. And that actually, if when the staffing's available, can provide care for up to another 200 patients if that's necessary. And then, just 2 weeks ago on a Saturday morning, on one of those daily calls with the city, we all realized that we had an immediate problem. In advance of these medical facilities opening up and coming online, there were homeless people that needed to be quarantined, and there was literally no place for them to go that day. So we began the call at 10:30 in the morning, and by that afternoon, Pine Street Inn was able to rent a hotel in Brighton, And St. Francis House committed to providing all of the staffing around the clock, 24/7, for the 2 weeks it was going to be necessary for these folks to be in quarantine until other capacity opened up in the system. Um, so at 6 p.m. that night, we received our first patients, and by Sunday, we were full with 54 men and women. To say that this entire system that has come online in just the past few weeks, it's been an enormous undertaking. It's required a mobilization of equipment, durable goods, supplies, staff, medical personnel, communication, transportation systems, um, and it's in recognition of the fact that people who are homeless, they need a place to be cared for because they have no home, and sick, infected people cannot be in shelter, and shelters cannot give them the care that they need. So, so what about the people who are not sick or who have not been diagnosed with COVID? What's being done for them? So I can tell you at St. Francis House some of the things that we're doing in our day shelter. So first, we've not changed any of our hours. We're still opening every day at 6:30 in the morning. And even though the night shelters are staying open during the day, at the beginning of this crisis, we were still seeing between 300 to 400 people every single day. Uh, I guess, unfortunately, over the past week or so, as more homeless people are getting sick and are in other uh, medical or recuperative care facilities, our census has dropped down to about 300 people a day now. We're also seeing new people coming to us. Since the last week in March, and this is through yesterday, we've registered 321 new guests into our system. Some of them are newly homeless, some are living in the homes of others, or if they have their own place, they've lost their income. And they're still coming to us for food and for clothes and to get their other basic needs met. And we are still committed and will always be committed to never turning anybody away. From an operations perspective, we've first had to look at who was coming into our building and reduce that to essential services personnel only. So what this meant was no volunteers. We had, at the beginning of the pandemic, we had lost many in the first few days anyway, as many of our volunteers are college students. And as the dorms and the universities closed down, they were leaving to go home. And another large group of folks that had been retirees and might be a little older, and they themselves are at an increased risk for infection. So we made the decision to eliminate all volunteers at St. Francis House. And without volunteers, though, and many of you are volunteers, so you know how critical your support is. So without volunteers, we switched to cold breakfasts and brown bag lunches. And to promote social distancing, we opened all the large gathering spaces in our building, and we're keeping them open all day. We moved from providing breakfast and lunch at certain times of the day to serving meals all day long in all of our spaces. Without volunteers, we can no longer provide guests with a choice of clothing. We're just handing out hundreds and hundreds of pairs of socks and underwear and t-shirts and sweatshirts, and we're running back and forth from the lobby to our clothing department to fill requests for pants and shirts and shoes and jackets. We're still making sure that our guests can still take showers and have access to all the toiletries that they need. But coming into the building is a very different experience right now. Early on, we began to screen all guests who came into our building for exposure and for symptoms of the virus. And over the past few weeks, what we've actually learned is that given the congregate nature of the way people are living in shelter, that as a system, we're all just making the assumption that at this point, all guests have been exposed to the virus. And then recently, when a large scale amount of testing was done at one of the Boston shelters, we learned that of all of those that were tested, and that was about 500 men and women, about 36% of those folks tested positive, and yet almost no one had any symptoms. And so what we're seeing is a significant uh, percentage of spread of disease and a lot of asymptomatic folks. So what we've learned is that, the screening tool is essentially ineffective. And as of yesterday, we're no longer screening on exposure and symptoms at the front door. What we do know, what is needed is universal testing, and we're working on a plan right now that hopefully next week, hopefully with the help of the National Guard, we can begin to start testing everyone who comes to St. Francis House. PPE has been hard to come by, but through a very generous donation from the Boston Medical Center, we've received enough masks last week for all of our staff. So every day our staff can have a fresh surgical mask that they can put on. And starting yesterday, we will also now have enough of a supply that we can provide all of the guests who come to St. Francis House with a mask as well. Right now, we have a supply for our guests that can last about 10 days, and hopefully we'll get more after that. One of our security staff, Henry, is also an amateur photographer. And so he's taken a few photos, and it captures a little bit of what it looks like inside St. Francis House. So I'm going to try to switch my screen right now and hopefully be able to give you a inside look at what it looks like at St. Francis House. So give me a second. As I said, what you can see right now is this is the front door of St. Francis House. And every morning we're opening our doors at 6:30, but by the time we're opening our doors, we're having a line of anywhere between 50 to 100 people are queuing up to get inside. This is another shot of that from our front door extending all the way down Boylston towards Washington Street. And that line usually extends to about the CVS, our building. And so, again, because had been screening and we're registering everybody who comes in the front door, the intake at the front door is taken a little bit of time. Every morning we begin our security staff, these community engagement personnel, they begin with a debriefing or what to expect for the day, what's happening. We're checking in on any kind of medical alerts that guests may have on them. If there's folks that are more vulnerable, at greater risk, or needing some special attention, we're being able to identify those folks so we can flag them as they show up at our front door. Our regular security measures are still in place, so people walk in the front door and we still, people are, I don't know if you can see his big suitcase people are carrying around with them, and we have our regular security measures, and then trying to engage with folks. Here's an aerial shot of that. You can see our staff trying to maintain some social distancing at the same time trying to engage and talk with people. It's been quite challenging. Here's Peggy. She's one of our CES staff, and I don't know, I just think this shot tells a lot. I mean, if you can see in her eyes, just, she's been working a lot of shifts, double shifts, and you can just see how tired she is. Here's three else of our staff people. When people go through the security check and then are screened, they're meeting with any one of these staff members, again, checking in on them. And then if people need further medical attention, we've set up a medical area on our first floor that's being staffed between St. Francis House and Boston Healthcare for the Homeless. And so even though, as I said, as of yesterday, we stopped doing the screening tool in the hopes that we're going to be able to start testing people, we're going to keep this medical area up and running. We're still having guests who have tested positive and they're showing up at St. Francis House, and we still need to create an isolation space within our building as we can arrange for transportation to one of the isolation spaces. There are some things that people still need. So this is a picture of our mail room. I mean, we're a mail service for over 1,000 of our guests where they get their snail mail. And so we're still being able to continue to make sure people are getting the mail they need. This is a shot of how we're scanning folks in. So everybody who comes to St. Francis House has a membership card. So every person comes in, they scan their card, and this has been essential because it's also the place not only where we know who's come and what they're coming to us for, how often they're coming to us, but we also are connected internally into a citywide alert system. So if we need to identify somebody who needs something more specific than basic care they're receiving, we can know that in real time and get them the help and support that they need. As I said, we've moved to cold breakfast and cold lunch, and so folks are coming in every morning. We're making hundreds and hundreds of sandwiches and breakfasts, and then passing that out to our guests. It's another shot of how we're trying to do that in the safest way possible. Here's a shot late in the day of our dining room, and again, just sort of seeing that um, how we're trying to maintain some social distancing, and people are trying to spread themselves out here and then in some of our other spaces. Yeah, our recovery support center. As I was saying, we had just opened up this recovery support center. It's a place for homeless men and women who are in recovery from substance use disorder, and it's a physically and emotionally safe place for people to come and get some support around their recovery. And so we've been, well, up until last week, we've been able to maintain that 7 days a week for everybody. But as some of our staff are now starting to get sick, we've had to scale that back to 5 days a week. But that's been a lifesaver for so many people. And, we're seeing anywhere between 60 to 70 people a day in this recovery support center. Um, Contact surface cleaning, we've outsourced, and we've brought in addition to our own housekeeping staff, we have a company that's coming in, and throughout the day, we're cleaning every surface all day long, and then we're doing a deep clean overnight. And then, this is a picture of the hotel. I told you that in Brighton, we needed a space to quarantine folks. So this, for the past 2 weeks, had been home to 54 men and women while they were being quarantined. Um, Breakfast, lunch, and dinner. There was an IHOP next door. So 3 times a day, we're going across the street. We're bringing individual bags of food and hand delivering them to people in their rooms. And this was our command central. So we took over one of the rooms, and there's Andrea Farina, our vice president of programming, and she was the on-site supervisor there for these past 2 weeks. And it's making sure that everybody's needs were getting met. If they had medical appointments, transporting folks to their medical appointments. And a few folks actually did become symptomatic. Some needed to be hospitalized. So it was quite an undertaking for the past 2 weeks. But yesterday, there's a shot of Andrea doing, keeping some distance and checking in on some of our folks. And here's 2 of our folks, and I'm even thinking about just the little things that people needed. One of our guys couldn't eat because he didn't have any Fixodent for his dentures, and so we're running errands to CVS to make sure his teeth were in his head. And then yesterday, by trolley, we were able to transport everybody from the hotel. Their quarantine was up, and folks were transported to Suffolk Dorm has opened up to Pine Street Inn and has created space there for people that have been medically cleared to get out of shelter and be in a more conducive environment during this crisis. So we were transporting people yesterday from the hotel to the Suffolk dorms. And then, I just loved this picture. People ask me, why are we doing what we're doing? And we do it for him. We do it, I don't know, you can see his eyes. He's comes to us, he's scared. And then this lovely woman, another one of our regular guests who's showing up every day, and has just come to depend on St. Francis House to get her needs met. So I think that's the last for the PowerPoint. I think if I stop sharing right now, here I am. Okay, getting good at this. Okay, so I think the other question that we're getting a lot of is how are we doing? How are the staff holding up? And what I can just say is that they are amazing. That every single staff person at St. Francis House has stepped up, and even though they're putting themselves in harm's way by showing up at work every day, there's no one complaining. There's they're asking how can they help. Uh, Quite frankly, that's where I'm getting my inspiration from in going through this. It's looking at them and how they're managing and how they're coping. And I can tell you they're scared. They're scared, they're tired, there's stress. It's at work, it's at their home. But the fact that they're showing up every day, and the reason they're showing up every day is because they know that the only people that are more tired and more scared than they are the men and women, the homeless men and women that are coming to St. Francis House. And we need to make sure that we're always there from them. And so I guess the last question is that I've been getting a lot is like, what can people do to help? And there's things like advocacy, right? It's not lost on me that when we say housing is a public health issue, this crisis has really put a spotlight on that. All of the work that we're doing, creating medical facilities and transportation systems and communication systems to manage the medical needs of people who are experiencing homelessness, we wouldn't need to be doing that if people had a place to live on their own. So if there's ever an opportunity that you have to advocate or support the creation of more affordable housing, I beseech you to do that. These men and women deserve better than what they're getting right now. And our staff, our staff right now, if there's one thing that you wanted to do, I think I would welcome any expressions of support that you could make directed towards them. That could be a thank you note, that could be a gift card. Um, some people you could send treats that we can put in the staff lounge. Yesterday, Boloco sent over 60 burritos, and I have to tell you, those were a huge hit for the staff. So lunch for the staff for the day. Anything that you could do to let them know that that you're appreciative of what they're doing for our guests, and that you support them, because they too are first responders right now in this crisis. If you can get your hands on some hand sanitizer, we could always use more of that. We haven't run out yet, but we're working our suppliers every single day. And masks. We're going through, as I said, about 50 masks a day for our staff, and now about 300 a day for the guests. And we've got a supply that lasts a little under 2 weeks, so we can always use more PPE. And of course, a financial donation is always appreciated. We've had such a tremendous outpouring of support from individuals, from corporations, from foundations. It's been so heartwarming. Uh, from on the corporation side, the Bank of America, Blue Cross Blue Shield, Citizens Bank, everybody stepped up. And then just this week alone, I got this surprise phone call from the folks at Liberty Mutual with a $500,000 gift. That is going to go so far to make sure that we can just keep that promise that we've always made, to keep our doors open and never turn anybody away. So the financial support has been tremendous, and means a lot to making sure we can continue to be a first responder to all these men and women. And I guess I would just end with how I am. And I guess the thing that I am the most, and when people ask me how I am, I'll tell you, I am blessed. I am blessed to be surrounded by coworkers that are as dedicated. I'm blessed to be supported by a community of all of you that cares so deeply about people who are homeless, because the thing we all know is that in a crisis, the people that suffer the most are the people that have the least. They are most vulnerable. And it is extremely important that we all come together to support each other, to support them. So I guess with that, on behalf of St. Francis House, on behalf of the guests and the staff, I want to thank you all for your caring and your support. And please take care of yourself, and God bless each and every one of us. Thank you.